You're tuning in to Why We're Here, honest conversations about companies worth joining, with Amit Matani, CEO of Wellfound.
Hey everyone, I am here with Elan Adler, the co-founder of CEO of OneImaging. Thanks for joining us, Elan.
Thank you for having me.
So I'm really interested in your company because I actually had an MRI recently and I hated the process. So I looked you guys up. I've learned a little bit about you, but why don't you tell me a little bit about what you guys do?
Yeah, radiology is the second most used service in all of healthcare. 45% of people age 18 to 64 that get their insurance from their employer or private insurance plan are going to use one of our imaging services at least once during the next 12 months. And so what OneImaging is a radiology platform and insurance plugin that lowers the cost of diagnostic imaging exams by 68% on average for any MRIs, X-rays, ultrasounds, mammograms, or CT exams, making it super easy and streamlined where you know the full cost that you owe. It's super easy to book as if you're booking an Airbnb. It's all integrated into your insurance plan, counting towards your deductible and your out-of-pocket maximum. And we only work with the top providers and help you for the whole process from the point in which we receive your order all the way through helping the results get over back to your doctor the way they would in any situation.
That's really cool.
So that's our core focus.
Yeah, so paint me a picture. So, I had some weakness in my shoulder and my doctor wanted me to go get an MRI. And the part was like, he's like, oh yeah, but you have to get an X-ray first because your insurance will require it. And it's like the process went for, I don't know, like 6 weeks. And then it took another 2 weeks to actually go back to him to like read my results. So what would that look like with working with OneImaging instead?
Yeah, so with OneImaging, what's very awesome that I love is the whole process is super streamlined. So the prior authorization process, we automate that and streamline it so you get it a lot quicker. We handle any hiccups that may occur, and then we help you go to the right place at the right time. So just like you receive a text message from CVS when your prescription is ordered, the same thing happens with OneImaging. When a radiology exam is ordered, you get a text message from us. Hey, Amit, we provide the radiology coverage and network for your insurance plan provided by insert the name of your employer or insurance plan. Click here to book your appointment. And then once we receive that order and take care of everything, within a few hours, you can essentially, you get that text message and you just book it. You go in and get your exam and we make sure that you're going to the right place. So if you're looking at your shoulder, you might want to go on a 3 Tesla MRI machine, right? Or if you have metal in your shoulder because of an implant, you might want to go on a 1.5 Tesla because there's actually going to be artifact that obscures and obfuscates the anatomy because of the metal. So we help make sure that you're going to really high quality places, that you're going to the right places so you don't have to get repeat exams. And before you go in, hey, I've hit my deductible, I haven't, and I owe this exact amount of money. And if you can't afford it, we help you with a 0% interest rate, buy now, pay later financing. So this is for everyone.
That's cool. So what's kind of the big vision of the company? Like, is it, are you guys primarily like, hey, we're going to be a marketplace for, people getting MRIs, radiology to the providers of radiology, or do you guys want to do something more? Like, what does this look like in 5-10 years?
Yeah, so I think for starters, like the main thing is that we want to be the one place for all of your imaging needs. Any insurance product or any healthcare product is really a marketplace, right? You have providers on one side and patients on the other. So you could call it a marketplace, you could call it an insurance product, you could call it a platform. But the big thing is like today or previous to OneImaging, your insurance plan may have said, hey, you should probably get physical therapy first. And it's a way to help lower the cost and maybe see if you'll get better. The reality is you might have a partially torn ACL and you might not know. Imaging is the only thing we have available to us that can look inside our bodies and see what's going on. You should not be going to get physical therapy or other things when you may make your condition substantially worse. You shouldn't get pain pills without knowing if it's a muscle strain versus a herniated disc, whatever it might be, or surgery without having the image of the inside of your body to figure out what's going on. And so our vision is actually bringing that back into the limelight of saying, let's do this the right way. Let's get your diagnosis first so you can figure out everything you want to do. And then guess what? Today, your images are in all these disparate places, right? They're in a PACS system is what they call it, or a RIS system, or an EMR. And patients are like, I don't know what any of that means. But the world that we're looking at is one in which you get your exam a lot quicker, you have more access, you save a ton of money to get your exam with higher quality care. Everything's streamlined. You don't have to go through authorization hurdles. And then, by the way, afterwards, you have all of your images and all of your data, not just the one you just had with OneImaging, but all of your previous images all in one place. And you, as a patient or a healthcare consumer, you can choose what you want to do with that. You can be in the driver's seat, right? So we all wear Oura rings and we have Whoop bands. We all want to know more about ourselves, but why don't we have access to it?
Right.
How can we help people actually be in control and say, hey, you know what? Maybe it's for me, maybe it's not for me, but maybe the for me thing is I want to take these images. I want to run them through an AI and say, hey, I have my medical records that say my grandma had osteoporosis or diabetes. And maybe the radiologist wasn't paid to read for bone density, but now I can check my bone density without having to pay for any extra care. And we can now enable people, maybe we can help facilitate one day a way in which they can help predict or prevent their own diseases at their own volition. And that's something that's going to save a lot of lives. And that's what I'm here. Like, that's what really drives me is I want to create serious value in healthcare today with the most advanced tools, the most rich source of data on the human body. Now, this only tracks 5 things, right? Your heart rate, your temperature, how much you moved. It doesn't see your muscle tissue, your bone density, all this insane data. And so what we're super excited about is giving people access to the most absurd amount of data about themselves that they ever could have dreamed of having. That's what's super exciting about what we're doing.
Yeah, it's interesting because I had a similar experience. So, when I got my MRI, the images came in and but my appointment wasn't for 2 more weeks to have my doctor read it. And I threw these into ChatGPT. I told them about my symptoms and stuff. And it's like, oh yeah, you're going to need surgery. And I was like, okay. So I was able to book an appointment with an orthopedic surgeon the next day before I even had to go to the doctor and stuff. And it was very empowering. It was like, oh, I'm just not at kind of the mercy of whatever health system we're under. I can actually take advantage of my own agency and kind of move the ball forward, which is really cool. Tell me a little bit about kind of the founding story. What brought you to this idea?
Yeah. I've been around radiology since I was a kid, since I was 14 years old. My best friend's dad was a radiologist. My dad started a radiology business with him. My brother was a radiologic technologist before moving on to another profession. I ended up getting a degree in radiologic sciences and MRI physics at The Ohio State University. I ended up saying, hey, I don't know if the clinical patient care is for me, but I love the technology and being able to, see inside the body. It's incredible. So I said, I want to improve this. I want to be a part of this. I want to innovate in this area. So I ended up going on to manage the outpatient radiology centers for the Cleveland Clinic in the South Florida market. From there, I went on to work at Siemens as a clinical consultant, where I helped run the operations for the largest radiology company in the US for their MRI division. And then I started to develop and commercialize new radiology products. So in 2017 or 2018, whatever it was, there was a company that approached my account asking for help to create a whole body scan. So I was involved in creating the first protocols for the first whole body imaging scan. That company went on to get acquired. After that, COVID happened and I helped bring to market the first remote scanning technology that's now used across the world to address the workforce shortages and distancing protocols. So that's when I got my taste of startups and innovation. I then went on to lead the enterprise sales and strategic partnerships team for Siemens MR product lines on the West region of the US and got, a footing with how to sell. And from there, same thing kept happening. Hey, Elan, you're the radiology guy. My doctor wrote me this order. Where do I go to get it done? That's lowest in cost, that works with my insurance plan, that can get me in for an appointment the soonest, that has good quality equipment and radiologists. And I couldn't answer that question, even though I'm supposed to be the radiology guy. So I said, hey, that's a huge issue. It was only then after that I realized, I was like, wow, I didn't realize radiology was that used. That is the second most used service in the largest sector of the US economy. And that the amount of people that this touches is way more than I thought. And bringing this to people in a way that improves the access, helps them get their mammogram, helps them get access to care in an affordable. I mean, 35% of people delay or forego imaging due to the cost. It was all these things that I started reading and I said, okay, I need to do something about this. I quit my job and I decided to put a bunch of my savings into the business early on and start building out a proof of concept and taking it to the market. And that's kind of how it started. And it was further exacerbated by personal story, more personal side of my father who had a lump in his armpit, had to get imaging, took forever to get the imaging. It spread to his breast tissue and it ended up being, stage 3 cancer, had to get surgery, radiation therapy. If he had access to imaging a lot sooner, maybe it's before it spreads,
Right.
right? And luckily he's okay, but a lot of people don't get the opportunity to survive that. And so you look at these things in perspective and you say, this is incredibly important to Americans. It's incredibly important to people. I mean, how many times do we watch, the movies like Avatar where you just get a scan of your body, right? To sit, the future, that's the future, right? You have shoulder problems, right? You just go and get that done. But there's a million barriers. You said it yourself. It's a pain in the ass. How do we make it not a pain in the ass and make it super accessible? How do we make it affordable? How do we make it just a simple experience? Because ultimately, that's how we figure out, is this a serious thing or not? And what do I do?
Why didn't something like this already exist? Like, why now? What has changed to kind of make this possible? Is there like some technology piece, or, is it just like, hey, we needed somebody like you who's kind of putting two and two together?
I think there were like things that like people that have tried and whatnot. I think I have the benefit and luxury of coming post AI, where we were able to automate a ton of tasks and get this off the ground at a lot lower cost. I think that there's also a huge component of, if you look at the news, there's a lot of employers and whatnot who offer insurance plans who are like, I don't know like what I'm going to do. This is my second largest line item after salaries and wages. And the cost of my health insurance plan that I'm subsidizing for my employees has gone up 50% over the last 10 years. I mean, I'm hearing about customers who are saying that their premiums have gone up 20% this year alone. Quite frankly, unfortunately, there's some players out there in this system who are hiding behind the guise of a nonprofit status and really price gouging in an insane way and using regulatory capture and other negative things on society to create, to capture patients and not feel like and give them the perception that they don't have a choice where they want to go, right? Like, you're the one spending the money.
Right.
Why is your doctor just writing your prescription for imaging just arbitrarily to the owner of the employer that he works at? Like, shouldn't you be able to say, wait, hold on 1 second. I actually know of 5 other places that are closer to my home that's lower in cost that have the same exact equipment and have the same radiologists that are reading for the hospital as reading for that place. Can't I just go there and I'm not going to have to wait 6 weeks or 7 weeks to get in for an appointment? So this is a way to say, hey, guess what? You now have perception of choice. You do have choice. You can go where you want, and it all works with your insurance plan. And here's what you will owe, and here's where you can go, and here's how quick you can get an appointment, right? If everyone's sending the same people to the same place, yes, there's going to be a 7-week backlog of patients. But if there's 6 other places that have the same equipment and same everything or better, and you don't have to wait 3 hours in the waiting room because they're servicing ER patients and ICU patients and inpatients at the same time, you start to go, well, why wasn't I being told to go there? Like, this is me. This is my healthcare. Why can't I go there? Well, now OneImaging saying, not only can you go there, but we're going to help make it easy for you to do that and to go there and for everything to integrate just as is the way before.
That's awesome. You mentioned AI kind of helped you lower the cost or lower the barriers to kind of get started or, move through this. The fact that you came in kind of post AI, like, paint me a picture. How has AI kind of helped?
Well, I'll just give like one very simple example for, everything in healthcare has typically run on a fax. You fax an order somewhere. Well, how do you do that at scale as a technology company? That's not a technology venture capital, scalable company. A quick example, we've been able to train a model to ingest all of that. Now we don't even have to deal with that because we're becoming integrated into medical systems where everything is just electronic. But when we were originally getting started, as an example, and we still get tons of faxes today, that has to be converted into a digital format. That was on a more primitive technology before called document OCR. Now you can trade Bedrock to do it for you automatically. That's just an easy example.
That's very cool.
There's a million of other examples like that where there would have normally had to be a whole administration of people processing documents, administrating, dealing with invoices as an example as well. I'll give another thing. We created a new financial rail system where we've been able to auto adjudicate medical claims off of a transaction. Well, the fintech stack to do that didn't exist before. Like, a lot of those companies are very new that didn't exist before 2020. So there's a lot of things that we're able to do now where before we had to have a back and forth exchange of in-paper invoices or medical claims, in other words. That's not venture scalable or a technology company to process paperwork. So now we're able to do that automatically at the point of sale using financial technology. So there's a lot of things like that that I feel very lucky on my
Right.
timing
Yeah.
to have behind us.
That's awesome. Tell me a little bit. You guys are a fairly young company, and you've raised a really big round. It was 35 million, right?
So we did a $31 million Series A,
Series A. That's awesome.
38
So,
million in total funding.
and so, what is how are you guys going to be deploying that? Like, where are the big areas of focus over the next couple of years?
Yeah. So I would say the big thing is continuing to expand our reach into more corporations and employers. We're now in Fortune 10, Fortune 50, Fortune 500, Fortune 100, et cetera. Continuing to saturate that market, continuing to find ways to automate scheduling, which is super exciting. So to really make it super, super seamless, everything from the exact appointment time down to the minute being available, all the way through all the paperwork that needs to get sent over and passed through. And then, of course, the big thing is consolidating all the imaging data and making that imaging data very accessible to people, right, is a big thing. And then another thing that we're really working on that we're super excited about is we're actually helping imaging companies expand their footprint in partnership with us. OneImaging branded imaging centers. We don't own them, right? But we're able to help create our branding and expand that into markets where there is no choice, there is no competitor. And we're able to use our model to reinsert capitalism back into healthcare. And just right, competition drives down price. And so we're really using this to expand our footprint on the supply side, expand it on the operation side. And I think those are, and expand it in terms of managing all that imaging data and making that imaging data AI friendly for people.
That's awesome.
That's the biggest thing.
And tell me a little bit about, the type of company you guys are trying to build. Like, how would you think about, the culture you're trying to build, the team that you're trying to put together? I'd love to hear a little bit more about that.
So I'll start with the culture piece because I think it can be summed up into one phrase that I always say, which is that I want to work with people that I can go and grab a beer with at the end of a hard day of work. It's people that you actually like. You're like, I'm friends with this person. They're not just my coworker. Like, I love this person. I want to go to bat for this person. The person who's standing next to me, right? Like, we have each other's backs. I have multiple employees who are having children, and I make sure to, have them send their baby registry, stuff like that. These are people I care about. That's the type of company that we're building. Really, people who are very obsessed with being innovative as well and changing. We have a very unique advantage here too, with the fact that radiology is this only area in healthcare that has this amount of insane data that says so much about everything. And so it leads me to the next thing about the type of company that we're building. Amit, I actually ask people this all the time. I say, hey, tell me, and in particular to like engineering, I say, hey, name me your top 5 favorite companies that inspired you because of the product that they built. And oftentimes they might say Figma, Spotify, Airbnb, Uber, Microsoft, Amazon, Google, Tesla, whatever, XAI, Neuralink, those, oftentimes as well. But you'll notice something. Did we name a single healthcare company? No, we didn't. There is no healthcare company that's inspiring people, that's really, really pushing the envelope, that says, here's what the vision is today that I just, shared with you a few minutes ago. But what can we do even differently, even more, even better? How can we completely change this where one day, if you're working at OneImaging, Harvard Business School calls you and says, hey, how did you build this at OneImaging? This should be a case study. This is incredible. An industry that we thought was too stagnant, that we thought was too old, that we thought was too gate-kept, that had too much barriers and regulation. Like fintech has a ton of regulation, but they were able to break through and they were able to create amazing products in that industry. Whether it's Brax or Ramp or whoever it might be, we can do that in healthcare. And radiology is a massive market with a huge long tail of data. And this is an opportunity to create the first healthcare company that inspires the next generation of people to say, hey, I want to work at OneImaging. OneImaging is up there with the Figmas and the XAIs and the SpaceXs and the Facebooks and the Googles and the Amazons and whoever, right? That is a company that completely changed something that I use every year or regularly that I can't imagine living without. Like, It's just what I know. What I know is to use OneImaging. What I know is to use the data from OneImaging to inform me about what I should do next with my healthcare, how I live, how I behave, what I eat, what I do. And That's what you're coming to when you come to OneImaging. You are here, like, I'm only looking for people that want to be a part of that type of culture that says, I want to be someone that inspires the next generation of people.
That makes a lot of sense. It's really interesting. Yeah, it's funny how important health is to everybody, and yet there's not a single company that's like, oh yeah, they're crushing it, or like it's really interesting. One of the things I found interesting with your company is a lot of you guys are remote, but you also mentioned that you guys are opening an office in Miami. I'd love to hear a little bit more how you think about your philosophy of like co-locating versus remote and the whole deal.
Yeah. So next year around this time, we'll have a beautiful office in Miami that I've been going over the specs on lately and super excited about. If people will say like, "Well, why Miami?" Well, little do people know is the other company that's growing super fast now at a $6 billion valuation in healthcare is Open Evidence. They're based in Miami. The founder of Rula, the founder of Papa, the founder of Public Interest Company, the founder of Health Gorilla, they're all here in Miami. We talk about San Francisco, we talk about New York, but ironically, Miami might be the best place in terms of the density of healthcare companies and founders that are here now. And not just that, but it's warm. There's incredible food. You have no state or local taxes, so your paychecks are much bigger. The mayor, the government is incredibly supportive of startups. There's a ton of startup density down here now. Before it was just crypto. Now there's a ton more. The founder of Better is here. I'm constantly meeting people. There's tons of funds here. And the government is constantly asking the community, meeting with us even, and asking, how do we get out of your way? How do we help you build faster? And that's something that other cities are not doing. I mean, there's a lot of, there's talks a lot of people are going to move from the current cities that they're in to Miami, of course, given the hostility towards entrepreneurship in other cities. This is the most entrepreneurial friendly city. It's not just tech. It's also everyday people that you'll meet. Everyone's an entrepreneur here. Everyone is super entrepreneurial. It is not the same Miami that it used to be. You have Citadel moving here. Amazon just opened up their office right across the street from where I am today. Google, Microsoft, Apple, they're all here now. This is really the place to build, in my opinion. And you get to have fun when you're doing it, and you be around a ton of young people, and the cost of living is substantially lower as well compared to a New York or an SF. I have tons of employees that are already asking me like, when are you opening it? Like, I want to move. I'm super excited to move there. Yeah. This really does feel like the Dubai of the United States right now, or the Dubai of the Western Hemisphere, where it's just every day there's a new skyscraper going up.
Is there something like the government's doing particularly around like healthcare startups that like has created a lot of density there, or is it just kind of overall entrepreneurship in general?
I don't know why healthcare is consolidated here so much over the last few years. It's not like that they're doing something, I guess, particular, but I would say that, folks here have been able to meet with state legislators and whatnot, and they're super supportive, and they're asking how they can help get out of the way more and be a better facilitator. And that's no one else. Who else gets to have those conversations? Like at Series A, Series B, Series C, where they have those relationships being built this early. I mean, that's not heard of. So I would say that that's, a big differentiator as well.
So last couple questions. You've been a couple years into it, a few years into building this company. Any learnings or advice to founders kind of starting their company, or maybe to you 3 years ago that you would have kind of told yourself?
Yeah, I would say adaptability is a must-have. Like, where you start is not even close to where you end. I would say, always ask yourself, why can't I? Is a common question that I always say. Like, when someone brings up a new idea inside the business, I always say, well, why can't we do that? I think that's an important question to always ask yourself. I would say tenacity and grit. A lot of folks describe me as gritty. A lot of other investors, a lot of our investors describe that. And so I think that that's been advantageous, which is just like relentless pursuit for distribution. You can have the best product in the world, but if you don't have distribution, it's just the best product in the world that no one's using. So I am incredibly relentless. I look at myself as a part of the sales team. I look at myself as part of the product team as well. But I very much look at myself as part of the sales team too, and just making sure that the beautiful things that we're building, every single person will one day use. And I'm obsessive about that. Obsessive about talking to, I just went to a benefits fair for one of our employers, right? To talk to the everyday healthcare consumer. So making sure that you're obsessive about it, making sure that you're relentless, that you're talking to people, that you're gritty, and always asking yourself, why can't I? And don't be afraid. You have to be incredibly fearless, even when your bank account starts to get really, really low, which happens to everybody at some point. You just have to be fearless and say, I'm going to figure it out. The worst case scenario is never as bad as you think.
Makes sense. Thanks, Elan. If people want to learn more about OneImaging, where should they go?
They should go to our webpage. They should reach out to, they should go to your page, see our job openings. They should talk to our head of talent, who you can find on LinkedIn. They should talk to people they know who are working here, or try to get a hold of someone that they know that knows someone that's working here. And they should ping me directly on LinkedIn, ping our head of talent directly on LinkedIn. Watch this video, watch other videos or other podcasts that I'm doing, but especially this one. And yeah, that's the best place to learn
That's
more.
awesome. Yeah, I'm rooting for you guys. Again, I've gone through the pain of it. I totally get it. I'd love to see you guys succeed.
I appreciate it. Thank you. And thanks for
your
having
time,
me on.
man.
Thank you for listening to Why Work Here. Ready to find your next role or discover top talent? Visit us at wellfound.com.